Hello, my name is Elizabeth Lim, and today I will be presenting to you a very common condition called urinary tract infections. Today we will talk about what is a urinary tract infection, what are the symptoms that you may experience, the diagnosis and treatment, and the management and prevention strategies. So what is a urinary tract infection? A urinary tract infection, or UTI for short, is an infection that affects any part of the urinary system. Its main function is to produce, store, and eliminate waste from the body. It is made up of four main parts: the kidneys, ureters, bladder, and urethra. There are two main types depending on the location of the infection. A lower UTI is called cystitis. However, if this is not treated on time, the bacteria can creep up the ureter and progress to become an upper UTI, which is a more serious infection or a kidney infection. So who gets UTIs? UTIs are very common. They occur in babies and young children, and they commonly occur in women. Statistics show that 1 in every 3 women will develop a UTI in their lifetime. And after 50 years old, UTIs increase almost equally with age in both men and women. There are many factors that also put you at higher risk. This includes medical conditions such as diabetes and kidney stones, incontinence, enlarged prostate and other prostate problems in men, and catheters. These are tubes inserted through the urethra to the bladder to drain urine. There are a range of symptoms that you can experience with a UTI. Note you may not experience them all. Common ones include delirium and confusion. Delirium is light confusion where your thoughts may get muddled or you feel disorientated. You may also feel the urge to go more often to the toilet, and when you eventually do go, you may find you can only pass a few drops of urine. You may also experience burning sensation or pain when you urinate, or you may also find your urine a bit smelly or cloudy, or there might be blood in it. You may also find that you are more unstable and fall over more often. Upper UTIs are often accompanied with lower stomach or back pain, nausea, vomiting or diarrhea, fever, and just a general feeling of unwell. Upper UTIs are more serious and you will need to see the doctor immediately for treatment. However, if you are unsure about your symptoms, please speak to your local pharmacist or doctor today. For diagnosis, the doctor will take a urine sample to find out what bacteria is causing it. The doctor may also ask for medical imaging if he suspects an underlying problem. Most UTIs are not serious if treated on time, and in most cases the doctors will give you antibiotics which will kill the infection. In this table you can see the courses of antibiotics will vary. Females will generally need to take it for 7 days, whereas males or more serious UTIs, that is your upper UTIs, will require antibiotics for up to 14 days. However, if the UTI is complicated or more serious, the doctor may refer you to the hospital straight away. Strategies which may help you reduce the discomfort of UTIs include drinking plenty of water to flush out all the bacteria. If you are getting any pain or fever, you can take paracetamol. Urine sachets can also neutralize the acid and therefore relieve burning sensation. However, before you start these, make sure you speak to your doctor or pharmacist first. There are several ways you can help prevent UTIs. Always make sure you stay hydrated and therefore drink plenty of fluids. If you have the urge to go to the toilet, do not hold it in. Make sure you go and always empty your bladder completely. For women, always wipe from the front to the back when you go to the toilet. And during sex, use a water lubricant and always empty your bladder after to flush out all the bacteria. Should you get any recurrent UTIs, make sure you see your doctor again for treatment, and further investigation is often required. Often treatment involves using a low-dose antibiotic for 3 to 6 months. Cranberry capsules may also help, although there is conflicting studies on how effective they are in preventing UTIs. Cranberry is thought to stop the bacteria from sticking to the walls of the bladder, therefore allowing it to slide off and prevent an infection. Postmenopausal women may also get UTIs as a result of lower estrogen levels, and therefore using a topical cream or pessary with estrogen may also help. As for men, recurrent UTIs are often due to prostatitis or other prostate conditions. Therefore, treating them will in turn prevent recurrent UTIs. In summary, urinary tract infections are very common. Symptoms can vary in individuals and range from confusion, burning sensation, going to the toilet more often, and lower back pain. UTIs are easily treated with antibiotics. However, they can become more serious if you do not see the doctor on time. Self-care management tips include avoiding dehydration by drinking enough water, always emptying your bladder completely, and when you do have the urge to go to the toilet, do go and not hold it in. Thank you for your time.